So again, good morning, and just want to put a little advisory out there first to start off. On November the 8th, on Sunday, from 3 o'clock to 9 p.m. at the Olive Garden on Wolf Road, there was someone that was positive. So if anyone was there on Sunday the 8th from 3 p.m. to 9 p.m., please contact the health department for area code 518-447-4659. So today marks 246 days. It's actually 8 months today that we're into, and it's kind of hard to smile, but it's going to be here for a while, and we got to get through this. And I know people are fatigued, but we will get through this, working together in a partnership and being there for each other. But sadly, I have to send my condolences and prayers to another family that lost a loved one. She was a woman in her 70s with underlying health issues that passed away last night. To the 144 other family members, again, my condolences and prayers go to you and to the new family that has gone through this difficult time. So to the 145 families, our thoughts and prayers are with you, and it's surreal. It brings all into focus of what we're at and what we're combating with. And it's just not here in Albany County. It's across the state of New York. It's across this nation. Dr. Whalen said it perfectly yesterday. For some reason, everyone's getting hit at the same time and our numbers are going up. Could it be the warm weather? I don't know. Could it be a variety of other things? I don't know. It's one of them things. It's here. It's hitting us, and it's not going away. So as of today, we have 4,188 positive cases of COVID-19, 1,520 people under mandatory quarantine. We have an increase today of 77 positive cases overnight. It's better than the 99, but we're back down to the 77 positives. While yesterday marked our single highest day, we had 80 new positives on April 25th and 71 on May 20th, just to let people know in the height of this where our numbers were at and where we're at. So again, these numbers are going higher. We have more people under mandatory quarantine than we ever had before. So these are numbers we continue to look at. So we also know 40 out of the 77 people, 42 people had close contact to a positive case. One is a healthcare worker and a resident of a group setting. 2 people have reported traveling. Again, 32 people don't have a clear source of infection at this time. It gets into what we talked about yesterday, honesty. Being honest, that's it. Just be honest. That's all we're asking you. Help us do our job to stop the spread. 18,315 people now have completed quarantine. Of those, 3,705 tested positive for the virus and have recovered. That's an increase of 7 recoveries. Here's the other alarming thing. There are currently 37 people hospitalized. We had 9 more people hospitalized overnight. 9 people. With a hospitalization rate of 0.88% of those who have tested positive, yesterday that was 0.85%. The last time we had this many people hospitalized was April the 29th. And I said yesterday, we continue to see our hospitalizations in the 30s and up to 43 people through early May. And again, being at 37 is alarming. 6 patients are currently in the ICU. We had 5 yesterday in the ICU. Now we have 6. Over the last 5 days, our average has been 67.6 positive cases each day. Yesterday, it was 66. Our 5-day average of new positive cases has again hit a high and a new high. Our numbers continue to go up in every category, and that's why we, unfortunately, are back to doing this for now, for the next feeble future of doing this every day. So there are now 8 cases in Albany County that are associated with, in our neighboring counties, that are associated with the the real estate show that happened up at the Desmond. So we're up to 8 on that. Some of the changes the governor has announced going forward, starting this Friday at 9 p.m., it's been put out there, but bars and restaurants are going to have to close at 10 o'clock, and they can do curbside pickup. So that's changed. Gyms will have to be shut down at 10, and restaurants also just for curbside pickup. So there's some of the things you have to look at. The state liquor authority will be required to close from 10 p.m. to 5 a.m. daily. So you will not, bars and restaurants, other than to curbside pickup at them hours. So the governor also announced that indoor and outdoor gatherings at private residences are limited to 10 people. 10 people, that's it. That's the maximum that you're going to be able to allow to have at private settings. And again, I know we just got through Halloween. We're still in that number of matrix that we still probably getting positive cases from that. And we have Thanksgiving around the corner. So please remember, less than 10 people. I know everyone wants to get together. I've said it yesterday, and I've heard people talk about it on social media. They don't care. They just want to get together with their loved ones. Unfortunately, the virus is not done with us. It's here. Until we get a vaccine and get that vaccine to everyone, this is our future, people. And the more we start shutting down or getting into different zones is going to be up to you. It's going to be up to everyone watching this, listening to this, that are either going to make the difference of how much longer we got to continue to go in this direction. Again, the cluster activities across the state. Further, the public health measures here in New York are in line with Connecticut, Massachusetts, and Rhode Island. So we're doing the same thing, except I think in some of the other parts, they're making it mandatory to stay in. One of the things, I'm saying this to the residents, and Dr. Whalen and I talked about it, and if you don't need to be out, please stay home. Please limit your activity to going outside. Please limit your activity to going anywhere. If you have to do something, do it. But Dr. Whalen's 100% correct. We don't want to go to lockdown. We don't want people to have to stay at home again. But we're there. And to the companies out there, fall onto your contingency plans. Make arrangements for people to work at home. And we have to cut our limit of being outside, especially with flu season here. And the fact that these numbers continue to go into the directions that they're going. So enforcement falls on local municipalities. The governor issued an executive order on October 6th allowing localities to issue fines under the sanitation code. Those fines are up to $15,000 for a gathering for a violation, $1,000 for not wearing a face mask, $1,000 a day for non-essential businesses opened up in violations. That falls to the towns, cities, and villages if they choose to do that. I can assure you there's not a mayor or supervisor that wants to do that. I can assure you there's not a police department that wants to go in and fine people. Help us. That's all we're saying, help us. No one wants to go into a private party and fine you $15,000 for violating the law. I know freedom isn't free, right? And I know people are sitting there, I have the right to not to wear a mask. I have a right to do this. You do. Do it in the privacy of your home. Don't go out in public and do it. You want to walk around without a mask? Do it at your house. Do it on your property. Go on a hike somewhere where no one's around you. Great. Go and enjoy it. But we need your help. It's not about freedoms, giving up freedoms or rights. This is a health crisis that we're in, and the only way we're going to get through this health crisis is by everyone being dug in together to get through it. So please, again, help everyone get through this. And, I've heard people are going to have Thanksgiving, come over to my house, I'm not going to wear a mask, I'm going to let everyone come, my neighbors. If you are challenging us, we will make sure the local police get there and fine you if that's what you want, if that's the fines that you want. Again, I said it yesterday, you can celebrate Thanksgiving 4 months from now, 5 months from now, 6 months. Zoom, everyone's been doing it. We got it down. People that couldn't Zoom can Zoom now. People that couldn't use FaceTime can use FaceTime. You can still have that interaction and do it safely from a distance. So please help us. Help us help you. So there's many places you can go and get tested, and we continue to put it out there. You can go to our website and get a whole list of it. But please go to our Albany County website for complete listing. Testing is free at state testing sites at the University of Albany. As always, you can call 1-888-364-3065. Our Whitney Young mobile testing sites are also available for kids for testing. And please call for appointment 518-465-4771. And there's other testing places like CVS, Walgreens, Rite Aid, Albany Med, Urgent Care, Priority One. Again, I can go on and on and on. But please, it's there, it's available, it's convenient, get it done. Dr. Whalen.
Thank you, County Executive McCoy. So as we see our numbers go up, one of the things that we're concerned about is something called exponential growth. And I know this is something that I've discussed before. But if unchecked, if you have COVID, you will likely spread it to at least 2 or 3 people, possibly more. Those 2 or 3 people spread it to 2 or 3 people each, and very quickly you can see that over a period of weeks, we could double our number of cases, or even go even higher than that. So this is again why it's important for people to follow advice of the local health department, why it's important for people to be tested so we can identify cases, and why it's important if you've been exposed to stay on quarantine. I've been looking at some of the comments too, and people saying, well, the numbers are higher, what's the plan? The plan is the same as it's been since the beginning. We have to control this individually. People have to take individual responsibility. We stood here in February before we had our first case and talked about community mitigation and talked about strategies like social distancing, like canceling large gatherings, like frequent hand washing, and early on introduced the idea of wearing masks before the CDC or others recommended. We discussed it here at this press conference. We continue to advocate, but I have to share with the public, there is no magic bullet to stop this. You are the deciding factor. You are the deciding factor of whether this spreads or whether this doesn't, each and every one of you. And if you don't take that responsibility seriously, the results could be very serious and even catastrophic. Again, it's very hard for people to realize what could happen in 2 weeks, but your behavior today influences what happens in 2 weeks. We're again concerned with our hospital partners about surge capacity, about individuals who may become ill and not be able to access the services they need if the hospitals are overwhelmed. I can tell you right now, my department is overwhelmed, very overwhelmed. Despite the great support of the county executive and the legislature, our staff is exhausted. We are answering hundreds of calls a day. We are tracking hundreds of calls a day. We are working into the evening every day. We are working 7 days a week. And if the numbers continue to go up, it's going to be very difficult to maintain continuity with the cases that we're getting. And I know we're not alone in that. There are other health departments across the state that have even gotten to the point to say, well, we can't do case investigation anymore. There's too many cases. So if you get COVID, here's what you should do. Again, those are the messages that we've been giving people from the beginning. But we are not, with a huge increase in cases, going to be able to continue with the work of daily phone calls, of supporting. We want to be able to do that. We need to be able to do that. It has been the cornerstone of our response so far. But again, as the county executive has indicated, when people aren't cooperative with us, when they don't give us the necessary information that we need, we see spread. When they're not doing what they're supposed to do, we see spread. We see increases in cases. So the options are to follow the advice, that you act as if you have COVID. If you don't, really consider what you're doing outside of the house if it's completely necessary. Limit social gatherings. And I have a family. I have 3 kids, and I have a big family locally. My parents live locally. And it's a big deal for us to make a decision not to get together on Thanksgiving, but all of us are very united in the fact that this is not a good idea this year. And it's a sacrifice that we're willing to make. And I think others should really consider that sacrifice. Dan has shared with us about a situation that he's aware of where a party was convened and people suffered because of that. Please consider those that you love and those that could be affected by those that you love when you're considering your Thanksgiving and even Christmas plans. We're looking towards the future. We are submitting a vaccination plan to the state before November 16th and working very closely with our state partners on preparing to do that. This is something that we have prepared for years to do, large-scale mass vaccination clinics. I think that we're prepared to do that, but we cannot control the supply and we can control the timeline. So that is controlled at the federal level, and it is dependent upon many things. We don't know yet whether there's going to be prioritization of the vaccine when it comes out. It's likely that there will be. So that magic bullet isn't coming for a while either. So I encourage everyone to do their part. It is essential so that we don't see our cases continue to increase in coming weeks.
Thank you, Dr. Whalen. And just to repeat what I said earlier, because I guess our microphone wasn't live on our Facebook, the Olive Garden on Wolf Road on Sunday the 8th from 3 p.m. to 9 p.m. There was a worker there with a positive case, so if anyone was there at that restaurant, please call our health department at area code 518-447-4659, 447-4659. And again, please, if you're there at the Olive Garden on the 8th of November, please go. Like I said earlier, we're into 246 days. This is the 8th month. Unfortunately, we had a resident pass away last night in her 70s with underlying health issues, and that brings us up to 145. So my condolences and prayers go to all the families. And there's 77 positive cases today. So hopefully that gets everyone up to par that didn't hear it in the beginning. I do, before I talk about mental health and everything else, do want to say this. It's not about challenging people. And, I got a lot of phone calls today. There was someone on a radio show today talking about challenging to invite the mayor, the county executive to their house for Thanksgiving, and they're not socially going to distance, they're not going to wear masks, they're going to hug and kiss. What's your point? I'm not here to argue with you and say what you can do and what you can't do. We need you as a partner. We don't need you. We need you to be part of the solution, not part of the problem, and not challenge the authorities. No one wants to go to anyone's house, especially on the holiday, and fine them or break up a party or arrest somebody, because why? But when you do something publicly like that, and I will say this: send me your address to my office. 518-447-7040 is my office line, and I'll make sure someone's there to greet you on Thanksgiving. And if you want to challenge it and get a fine, so be it. But please be part of the solution, not part of the problem. We don't need this. We need to come together as a community in a partnership and be there and help one another, not challenge the authorities or challenge people. We're better than that. We're better than that. So again, if you need our mental health hotline support number, 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline number is always 518-447-7716. Our 211 number with United Way and the New York State hotline. Thank you, stay safe, and do the right thing.